Thank you for inviting me to talk to you today about how we've been using LT over the past couple of years. So what I thought I'd do is I'll share my screen and take you through how we've been using LT and what happened previously before LT existed. Okay. Right, so hopefully everybody can see the LT screen. Yeah? Can I have a quick
Yeah, that's
nod or
perfect.
something to acknowledge?
Thanks, Dawn.
Brilliant. Okay. So I'll give you a couple of seconds because I know when we tested it, the quality wasn't too great till it got used to working to it. So I'll give you a bit of background about how we've been using LT in Warwick Medical School, particularly at University of Warwick. So we've been using the Power Labs for many, many years in the School of Life Sciences for physiology practicals. And when Warwick Medical School was set up, we wanted to continue giving the opportunity for some hands-on learning for our medical students, because as a graduate entry degree, we've got a range of students coming in. Some of the students have biological sciences backgrounds, but a lot of them are coming from the health sciences or alternative career pathways. So they don't have a lot of hands-on physiology experience. So we've been using these packages, firstly using the Power Labs and then moving into LT when that was developed to generate an interest and some fun in physiology teaching. So more recently, in times BC, before COVID, we principally used LT for physiology teaching in the labs, and then later we moved into small group teaching with the cells and tissue biomedicine aspect of the course. So we use a number of the LT packages to help create our lessons, and the three ones we focus on at the moment are the anatomy package, understanding of physiology, and also the preclinical medicine, and using all the patient cases that are part of that package. So just to show you some of our, this is the opening screen that our MBCHB students see as they enter the course. So these are all the areas that we covered and the different blocks that are involved in teaching on LT. And our reason for choosing LT as a teaching package is because it's so easy to use. It's very user-friendly, it's intuitive to use, and you can easily and quickly create something that looks really professional and in quality. And the staff seem to enjoy working with it as well. And so I've just put a couple of quotes here. So Dr. Lida Mirbahai, who's the theme lead for the new undergraduate HMS, Health and Medical Sciences course in WMS, she puts, in general, she loves it. It's easy to create lessons and the end product always looks polished. And then Dr. Emily Unwin, one of our clinical skills tutors in WMS, says the same. And people seem to really enjoy putting together teaching on the package because it does flow really well. It looks professional and it makes such a difference. But if we take a step back and look at where we came from, so if I can move the screen over so I can click the buttons. Right, so we started off when the curriculum was refreshed in 2013, 2014. The then head of school at the time wanted to make physiology more accessible to everybody. Like I say, we have a mixed cohort of students and some of them have never come across physiology before, and they can often find it quite a dry topic. So we wanted to get some hands-on teaching into the course. So we started using Lab Chart and then Lab Tutor, but as soon as LT became available, we moved straight forward to using this because it seemed a lot more fun for the students, a lot more interactive. So we use this to encourage engagement with the physiology and part of our cells and tissue biomedicine teaching. And once we set the optional labs up, we then move towards bringing it into the normal regular run-of-the-mill teaching week by week. So we brought in some physiology workshops that I'll show you in a second. So these hands-on sessions are devised to get the students to record their own physiology readings, to compare it to clinical cases. So for the MBCHB particularly, everything is skewed towards the clinical scenarios. We use a lot of the patient cases and we're bringing in our own patient studies as well to make it more realistic for the medical students, to make them understand why they need to know the physiology. And the gamification actually helps as well. This active learning compared to passive reading of Gray's Anatomy, medical physiology, it makes it more real for them. And the activity actually helps with their learning. So what do? We'd use it across a range of topics to actually generate interest and fun in learning. So to start with, we started off using it for lab work. Now, because of the timing and we're competing for lab space with the School of Life Sciences as well, we ended up having to make these optional. So not everybody had the opportunity to actually go into the labs and record their own nerve functions or record their own ECGs. And we always did this according to or related to clinical cases. So they start off with a clinical scenario, which is exactly what they'd get in the case-based learning sessions that we run, and it makes it more realistic for them. So we start off with a scenario, we get them to work through the patient case as they would in the clinic, and then get to the point where they're going to run some tests on the patient. So this will be comparable to the tests they're running in LT. So it makes it all realistic for them. They're recording their own physiological responses and comparing it to what the patient's actually provided. So for nerve conduction tests, this is a really popular one. I always call it the Friar Friend practical, because you actually set up to stimulate the nerves and record the responses. So we're looking at nerve conduction and also EMG as well. And then we have a case that's myasthenia gravis, so they can compare their results to what the patient case would have shown. So you can actually see the difference, and it makes it more realistic for them. And then they answer questions about the treatments and how you'd manage the patient. So we're trying to bring in all of the skills all together and integrate it in this way as well to make it more realistic. And I have to say that we are itching to get our hands on the sensors, because we can actually take this out of the lab and avoid all the problems with timetabling and lab space availability, and actually bring it into the classroom, because it's going to make such a huge difference to our practicals. So we're really excited about that. Okay, so as a progression from the optional workshops, we actually managed to get some time in the timetable, which is at a premium, to develop some physiology workshops that we could run opposite CBL sessions, case-based learning sessions. So we started off with looking at the blocks and looking where we could bring in a little bit more hands-on material. So this just shows you some of the things that we do in block 1. So this is health, homeostasis and metabolism. So we have sessions on homeostasis. We look at the histology, and that's using the anatomy LT package. We also look at kidney function and kidney disease. So these are all linked to patient cases as well. And there's liver blood tests. And we also do a little bit of hands-on in this block by getting them to perform urinalysis, which we were able to do last year, which was quite exciting, but things all changed quite dramatically, as we know, of last March. So this just shows you some of the things that we've actually brought in to LT. So for our urinalysis, we get them to do the dipsticks, we give them patient profiles, we link it through to videos showing how they should be performing a dipstick test, get them to analyze their own results. And we also present data like they would see out in the hospital. So this is set up to the same format that you'd see in the local trusts. So when they go out into the trust and see these, they know what they're looking for. So it really helps their learning this way. And then for the other blocks, so the first year of the MBCHB, or phase 1, is divided into 5 blocks. So the first one's health, metabolism and homeostasis. The second one is cardiovascular and respiratory. So we did things like respiratory histology, again using the LT packages, central control of respiration, which was a learning package that was on LT. We do peak expiratory flow rates, where we have the peak flow meters and then get them to input all their data into LT, calculating heart axis, practice ECG interpretation. We also run the optional labs where they can actually go in and record their own ECGs and calculate their own heart axis, which are really good fun, but we don't get such a big uptake in these sessions because they are optional, because they're on the Wednesday, which is the self-study and well-being day. And we also do things like blood count and anemia as well, to get them practiced at annotating test results and seeing where the problems are and seeing if they can apply it to the case situation that they're presented with. For block 3, which is my block, which is brain and behavior, we look at the histology of the nervous system, we look at how the communication and neuroendocrinology runs. We also did some really fun experiments on LT with the special senses, getting them to count their taste buds, see if they're a super taster, and also looking at how perception can change depending on the different sensory inputs that you're getting, which is really fun. And then again, we have some application looking at CNS samples to see if they can pick up what types of infection the case scenarios may be leading to. So it's all hands-on application of the knowledge that they're getting in the lectures as well. Now for block 4, we did some really fun practicals. So we're looking at the bone strength, we were looking at cartilage and muscle and bone histology, connective tissue histology. We had a fun session on the neuromuscular junction, which a lot of students can find quite intimidating. And we looked at the bone profile and markers. So again, for all of these blocks, you're looking at what samples will you be taking, how you can interpret them, how you can analyze them, and how you can apply it to case scenarios. So it's a lot of application. And this is where LT has been key for our development. It really helps you. You can put boxes and get them to annotate figures and draw routes and pathways and mechanisms. It all makes it really interactive, and it helps you store that information for use at a later date. So we had some pretty good feedback from our workshops, and we were hoping to develop them further and try to expand them out. So these were running once a fortnight within each of the blocks. And this year we're hoping to bring that into at least every week if we possibly can, because it's such an important topic for them to learn about. We feel it's really key that they get as much hands-on experience as we possibly can. And the student feedback was really good. So a lot of them say they like the combination of lectures plus the workbooks, as it caters to a lot of different learning styles and learning approaches. And this was working really, really well. But as we know, last year in March, everything started to go a little haywire. And that's when we all had to really spring into action and working together as a team, transfer the entirety of medicine to an online course. So that raised a few challenges for us. So we'll have a look at what we did during the pandemic. As we know, we were all told medicine must continue, the students must graduate, the training must continue. So we had no choice. We had to just get going and develop our teaching as an online medium. So it threw us into a bit of a loop, but we knuckled down and we managed to get block 5, which is the final block of year 1, into an entirely online format, which is no small achievement, I can say, but everybody just really threw themselves into it. And as a result of the ease of use for LT and the applicability for this situation, there was a lot more interest in using LT. We've been using it for physiology for quite a few years, but now other modules and other themes were looking at using LT as well. So we developed a lot of pharmacology teaching online using LT, and also the clinical skills team were really interested in using it, and they've been one of the big developers over the last year. Now, during this time, we also had new courses starting as well. So the new undergraduate teaching, which is Bachelor of Science in Health and Medical Sciences, that started in September 2020. So this is a new course, and right from the start, the team had decided that they were going to use technology-enhanced learning to account for about 30 to 40% of the overall teaching. So we already knew that LT was going to be a big player in this, and it really came to the forefront during the pandemic. And then also the postgraduate teaching, surprisingly, were interested in using it related to the clinical skills elements, and also the fact that the patient cases were so good that they could adapt them really quickly for use in their own teaching. So we're spreading out and infiltrating the LT usage across the department. And it seemed to work really, really well for them, and hopefully they'll keep going with it. Now, there are some differences in the way we use LT. So for the undergraduate, the MBCHB course, we only use LT really in the phase 1 teaching. However, there is a little bit of interest in expanding it further. I know a few of our lecturers are quite keen to utilize this resource further through the course, whereas the health and medical sciences will be using LT for the entirety of their 3-year course. So the students will get access to all the teaching all the way through. And advanced clinical practice, they've been using it for every time they run the course itself as a medium for delivery. And again, they do like the combination of lectures and workbooks. It caters to everybody's type. I don't know why I put that quote in twice, because I do have other ones, but they seem to enjoy the integration and the hands-on. However, it's not always 100%, and I'll explain that as we get towards the end of the session when we look a bit more at the feedback. So this just shows you the front page of my teaching block in the new undergraduate course, which is mental health and neurobiology under the wellbeing package. And we do use LT for our technology enhanced learning quite a lot in this course, and it seems to go down really well. So as we've branched out, we've also asked for feedback from the students about what they think about LT as a medium for teaching. And it is really, overall, it's positive. So for the clinical skills sessions, the student feedback from the MBCHB was that the LTs were of really good quality, and it didn't detract too much from their learning, not having the face-to-face lecture type learning. And for the HMS students, again, they have the advantage that they're coming in new, that they don't know what to expect, and they seem to enjoy the multiple ways that we deliver their teaching. So they said the information and the tells was presented in lots of different formats because we can use images, videos, hands-on drawing, bullet points, paragraphs, all the different medium. And they say it makes it easier to digest the food. And again, we'll come back to this further through the talk. So to show you the different ways we're actually using it for online teaching, we start off with the basic learning. We'll often provide them with information. We've used a lot of the Understanding Your Physiology to help with some of the teaching for the undergraduate course, which I'll show you later. But this is just one of the pages from the MBCHB Block 5. So these were the first developed teaching packages that we did in the pandemic. So to start with, we'd give them a little bit of information about how you'd go about drawing a genetic pedigree. So this is from the Block 5 teaching on genetic pedigrees. We put links out to the Health Education England sites that do amazing teaching packages for genetic teaching. And also that counts for your CPD as well. So we've put links through to that. We've also provided them with a bit of hands-on so they can contact me to get a pedigree learning tool, which is shown here, to help them draw out genetic pedigrees. And then we give them lots of questions to practice with. So this just gives you an idea about one of these. This is one of my favorite LTs, and I really enjoyed developing this one because it was so much fun to do. So, I mean, you could have a look at this and maybe try drawing out your own family tree. So we give them Harry Potter's family tree, so written, and then expect them to draw this. So the annotate buttons are really simple to use. So I can just show you how we can add in some figures. Whoops, if I can draw my, okay. So here's one in true Blue Peter style. Here's one I prepared earlier. So the family tree, and then get them to check the answers and give them the explanations. So it was a fun way to get them to practice drawing out family trees and then getting them to work out whether genes are dominant, recessive, and the rest of the family tree history and taking history. And they seemed to really enjoy it. The feedback was overall pretty positive for this one. I had some really nice comments from the students. So I really enjoyed the genetics, especially Harry Potter's family tree. And then just wanted to thank you so much for the genetic pedigree workbooks. Really, really interesting. And I loved how you slipped in Harry Potter. So overall for these sessions, the feedback was incredibly positive. And then this was our first time at trying to integrate lectures into LT. So we've done this a lot as we've progressed over the year. We've integrated sections of lectures, but this was our first trial run. And Judy and I worked together over one weekend to integrate her lecture on labour and birth into LT. So I'll just give you a quick blast. And this was our first trial at doing it and using Teams. So we carried on integrating this, and we're using as many tools as we possibly can to make the lectures a positive experience when they're delivered within LT. So a lot of the times now we'll put a section of lecture and then follow it up with some questions to make sure they're understanding the teaching as we go through. So it's a really good way of embedding and consolidating the material. And again, the feedback's really, really good. But the staff feedback was amazing as well, because we were trying to turn teaching around in such a rapid pace. They were really pleased that they could actually manage to deliver their teaching on time and in a presentable format, given the fact that we were all running at full pelt at that time. And the integrated sessions have become more relevant and more strategic as we've gone through the lecture. However, some of the students have accused us of increasing the teaching materials by stealth mechanisms, because we're bringing in lectures, but we're also adding in questions. So it might be more than they would be expecting to do in a normal hour. Okay, and one of the key things we've tried to develop is the use of patient cases, because this is what the medics love, and it's also what we're finding the health and medical sciences students love as well. A lot of them are interested in a career in public health, or maybe management, or maybe even moving into medicine. So they're all interested in the patient experience and the patient perspective of all the topics that we discuss. So we've included patient case studies, and we've actually started to develop our own. So this is just a page showing one of the pages from an anxiety and stress workbook that I developed with our clinical health psychologist, Harbinder. So she actually spoke to one of the patients. I won't show you the image here because he's only approved it for education use, not for promotional material. But we've integrated his clips and his discussions about the effect of COVID on his anxiety levels, because he had a previous condition as well. So we've managed to integrate an awful lot of interaction and also patient perspective and patient experience into the sessions. And again, the student feedback is really, really good. So a lot of them actually enjoy the integration of the patient cases with the real tests because it makes them feel more clinical. They're actually dealing with the patient, working through their test results, trying to determine what the condition is, and then thinking about how they'd management and how they'd help the patient and support the patient through these conditions as well. So it's been incredibly positive. And then, as I said before, the clinical skills team have been using this to develop their teaching as well. And they work as a team really, really well and work together on their workbooks as well. And that seems to be one of the advantages that they find, is that all the staff have access to the teaching materials, so they can go in and edit and check each other's workbooks. And it makes it really fluid and also ensures the consistency throughout their teaching theme as well, so that everything follows the same pattern and makes it recognizable for the students. So this just shows one of the cardiovascular pages developed by the clinical skills team, and they actually included the heart sounds. So you can hear normal heart sounds and abnormal heart sounds, again, to give students practice so that when they do get into the classroom to attend the clinical skills sessions, which were allowed because they're part of the clinical training, they knew what to expect when they got into the classroom. So it had massive advantages for the students in this point of view. And like I say, the team actually said one of the good things was that it saves your work automatically. You don't have to worry about losing material, and that multiple staff members and team members can work on the same workbook and give input throughout all the development, which is a huge advantage. So you don't feel you're working on your own on your teaching. And one of the good things as well is that we've actually also used it for open days. So I do a physiology taster session where we look at bone strength, and yeah, it's really good fun, and it allows me to extend my kitchen science experiments that seem to have been going on quite a lot during the pandemic. So I take the potential medical students through a quick session about bone strength and bone development, and then get them to perform as many experiments as we possibly can at home. So I get them to build an osteon and see how the strength changes with a concentric ring formation, so they start to understand how the physiology and formation of bone lends itself to a huge amount of strength. And then again, we also do the patient cases with them as well. So if we were doing this in person, which is what we did with the first year medics when we were still running face-to-face sessions, we actually developed 3 bones types and then presented patient cases and got them to work out which of the bone types fit which of the cases. So I also do this as part of the open day when I show them the bones, the different bone types through the camera, so you can actually see bendy bones. And it's really good fun, and the feedback from the open day has been absolutely fantastic, and they all enjoy working out which of the case scenarios fit with which bone type. So it really adds something special to an online session, which could be potentially a little bit dry. So that's one of the fun things that we've been doing. And then for the HMS sessions, as I say, 30 to 40% of those teaching sessions are technology enhanced learning. So we've been using a lot of the understanding of physiology, because again, our new students come from a range of backgrounds. So some of them don't have a high neuroscience or biology background. So this is a really good way for them to learn. So these are just taken from the understanding of physiology package, and to introduce them to the topic, and we include videos and lecture segments for them as well, and also extra reading for those keen students that really want to go and explore a bit more about the topics. And we'll keep doing this when we go back to face-to-face, because the TEL sessions are such a big part of this course. So it's really exciting. And it's not just the science as well. We also cover a lot of the health science aspects as TELs. So we're developing joint sessions like I've done with the health psychologists to integrate all the information together, because life isn't segmented, it's not compartmentalized. So I think they need to realize that everything integrates together, and you can't have the medical sciences without the health sciences. It's all part and package. So this is just an example of another session we were doing on the history of treatment for mental health, where we looked at hydrotherapy, but we're also encouraging them to do their own research as well. So we've got boxes at the bottom to get them to dig a little bit deeper and try and find some primary sources showing the evidence for and against different treatments, and then posting those on the forum to initiate discussions between the groups to try and get them to explore these topics in a lot more depth, as we'd expect them to do as researchers. So that's what we're doing at the moment, but where are we going next? I think the big thing is we are itching to get our hands on some of the sensors, because it will take our teaching to the next level. We'll be able to do a lot of the sessions we want to do in the labs, actually within a classroom situation. So this is really exciting for us, and we're really keen to get going on this element and using these within both the medical degree and also the undergraduate course as well, to make it a little bit more hands-on, and it makes it more real for the students and more memorable, which is key for their learning. Okay, so we do have a few things to watch out for, but I'm a little bit wary of the time. So I can just say to you, we have noticed a few factors about how LT is perceived. One of the key things we have noticed over time is that if you have more than 13 pages, students tend to get a bit antsy about this. There seems to be a critical amount of information that they like within their LTs. It hasn't all been positive feedback, and we find that with the graduate students, because they've come from an already previous academic background, they're used to having their information delivered via lectures or going and reading from books. So it is a bit of change of a mindset. So we've been trying to encourage them that actually active learning is the way forward. It makes it more memorable, but some people do struggle with that. So we do have some negativity towards LT, but it's just that change in format. We haven't seen that at all with the undergraduates, interestingly, because they've not experienced it before. So everything's new and they're excited to get involved. So overall, it's been very well received. We've got a few ideas how we'd like things to change, but I know I'm short of time now, so I'll stop. And if there's any questions, I'm happy to answer them.
Fantastic. Thank you, Dawn. That was great. A couple of questions, if we can quickly go through them. I think Richard said you've already kind of answered his question. So just one, are these workshops things you've developed yourself, or you've adapted them from LT lessons?
A bit of both, actually. So there's some I've developed, and there's some the other team members have developed for the cell and tissue biomedicine team, but we've also integrated sections from other labs as well. We use the patient cases, sort of edited those videos to fit our case scenarios. So it's a mix. We've used both.
Other one was just, how did you get things across so quickly into LT?
We had no choice. so it really came down. Yeah, absolutely. I mean, we were working around the clock, but we had no choice. We had to get it done, and you have to find a way. I think, yeah. And with the accessibility issues, that was the thing that took the longest, working out how to actually get the captions into the LT videos. That took me the longest, but thanks to Tom, it worked out fine. But it's been a challenge, but when you have no choice, you just get on and do it.
Fantastic. And I think I'll answer one last one, and then maybe you can chat back to some of the people that have asked a few more questions, if that's all right, just so we can move along. So one question from Elizabeth Prabhakar was, do you do any assessments on LT currently?
Yeah, we were looking to do that, and we developed an awful lot, but with the university regulations, we ended up using their assessment platform. So we didn't actually, it was disappointing because we were quite keen to use it and it looked a lot easier, to be honest, and we'd set everything up, but it just didn't go through in the end. But I would really have enjoyed using it for the assessment. It looked so great, and you can bring in the drawing, whereas you can't do any drawing or annotation on an online format that we currently use.